Hi, good afternoon, and welcome to the Out for Mental Health State of LGBTQ Communities Legislative Briefing. My name is Amanda McAllister-Wallner. I use she, her, hers pronouns, and I'm the co-director of Out for Mental Health and the director of the California LGBTQ Health and Human Services Network. Really excited to have you all joining us today to talk a little bit about our 2019 LGBTQ communities survey and bisexual needs assessment. We'll be telling you more about what that means in a little bit. But first, we just wanted to introduce who we are.
Hi there, my name is Seve Christian. I go by Seve and I use they, them pronouns. I, for the last year, have served as the Senate consultant to the Legislative LGBTQ Caucus, which you can see by this lovely slide, was formed in 2002 to create a forum for openly LGBTQ legislators to talk about the issues that impact them. Because we're on such a tight schedule, I'm going to keep my update brief, but just know that for the past year and for many years now, the caucus has been working to prioritize the issues that are impacting LGBTQ Californians and LGBTQ people generally. This year in particular, we were able to get some really phenomenal wins through the legislature. One of them I had the pleasure of working with Amanda on, actually, SB 932 for COVID-19 data collection to make sure that sexual orientation and gender identity were captured in those data collection effort processes. So if you ever have any questions, feel free to reach out to me directly or anybody within the caucus. I'm so happy that this briefing is being put on. We have so many great presenters here today that I'm really excited to hear. Thanks so much.
Great, thanks so much, Seve. And Out for Mental Health is a statewide project that engages LGBTQ people throughout the state to develop a mental health equity agenda and offer tools and resources that address LGBTQ health and mental health disparities and make our shared goals for communities that are thriving and healthy a reality. We do this through research, through trainings and advocacy. And we're have a great team with us today and a great group of folks presenting. We're also, we are funded through the Mental Health Services Act, Proposition 63, and the Mental Health Services Oversight and Accountability Commission. All right, so our presenters today are going to introduce themselves.
My name is Poshi Walker. My pronouns are Z, Zers, Zers, and I am with Cal Voices, and I co-direct Out for Mental Health.
And I already introduced myself. I'm Amanda McAllister-Wallner.
Hi, everyone. My name is Nicole Scanlan. I am the project coordinator for Out for Mental Health, and I'm the LGBTQ program coordinator for Cal Voices. It's nice to be here today.
Good afternoon, I'm Tania Israel. I'm a professor at UC Santa Barbara in the Department of Counseling, Clinical, and School Psychology, and I'm one of the collaborators on the Out for Mental Health project.
Hi, everyone. My name is Kristina Esopo. My pronouns are she, her, and I'm a doctoral student at UC Santa Barbara working with Dr. Israel in counseling psychology, and I also am a collaborator on the bisexual needs assessment.
Hello, everyone. My name is Luis Armando Parra, and I'm a postdoctoral scholar at at University of Southern California. And I went ahead and led the queer and trans oppression, multiple intersectionality discrimination section of this report.
Oh, Poshi, you're muted.
There we go. Sorry. We're going to start with our Out for Mental Health community survey findings. Next slide. In 2019, we released an online survey in both English and Spanish. We had over 2,800 LGBTQ Californians participating in that survey. Today, we're going to present some of the highlights from the findings from that survey, along with a more extensive write-up in the now to be released Out for Mental Health report, Surveying the Road to Equity. We hope that this info will help inform your work as you move forward. Next slide.
All right, so the big goal of the survey was to get an idea of the health and well-being of LGBTQ Californians. And we started off by taking a look at one of the important factors to LGBTQ health and wellness, insurance, health insurance. We know that it's an important factor in accessing healthcare, and we were happy to learn that the majority of LGBTQ Californians are insured. 89% of our survey respondents did have some form of health insurance. And we see there's a big variation in different LGBTQ subpopulations and what type of insurance they have. And we see that Medi-Cal is an especially important healthcare safety net for queer and trans people of color in California. This means that we have a lot of work to do to protect the attacks on Medi-Cal from the federal administration, which has tried to roll back some of the expansions we've seen in California. It also means that when we look at quality of care, improving the quality of Medi-Cal services is incredibly important to achieving our health equity goals when it comes to LGBTQ Californians, and particularly the health of LGBTQ people of color in California. Next slide. So, obviously one of the goals for improving LGBTQ health is to get that number from 89% to 100%. And how do we make sure that all LGBTQ Californians have access to health coverage and also have access to the highest quality health coverage that they can? The first step, which is going to capture the majority of the remaining uninsured here in California, is to expand Medi-Cal to include all income eligible Californians. There's been a big multi-year campaign around this called Health for All that probably a lot of you are familiar with. We've made some great gains in the state of California, becoming the first state to expand Medicaid coverage to undocumented children and to all income eligible young adults, regardless of immigration status. And so we do have some work to do to continue to expand on those successes and further remove barriers to Medi-Cal for income eligible Californians. The second piece is providing greater affordability assistance through Covered California. We know that cost is still a major barrier for many Californians in accessing healthcare and health insurance. And so, giving people access to those silver and gold plans in Covered California is another really great way to improve the coverage of LGBTQ Californians, and making sure that folks are not opting into those bronze plans, but are actually being encouraged to get those, those lower deductible plans that cover more and that cover preventative services in a meaningful way that people are actually using their health insurance. And then finally, increasing access to employer-sponsored coverage by funding LGBTQ employment programs. Employer-sponsored coverage is still a really important part of the health insurance fabric in California. It's still an important way that many LGBTQ people are getting covered. And so when we see higher rates of unemployment in our communities, when we see higher rates of employment in jobs that don't have good benefits, that are underpaid, that hurts our community's health too. Unemployment oftentimes means uninsured as well. So making sure that we're providing support for programs such as transgender economic empowerment programs go a long way toward making sure that LGBTQ people have health insurance. Next slide. And then the other major thing that we wanted to look at was, you know, among folks, we know that having insurance is only part of the equation. Even among people who do have health insurance, we know that LGBTQ people experience challenges to the quality of their care, and that they often avoid or delay health care because of experiences of provider discrimination and rejection, because of long wait times, long distances traveled, and because of high out-of-pocket costs. Next slide.
So why we're, I'm sorry, that's fine. No? Okay, advocates have tried multiple times to mandate LGBTQ competency education for both mental and physical health providers. The pushback has been that this education is not needed, that they get it already, we don't need to mandate it. However, our research shows that it is needed, and just to highlight that need, one town hall participant told us that I had a doctor tell me when I was in mid-transition, quote, "I'm overwhelmed, I haven't been trained, and I don't know how to treat you," unquote. I felt lost, like I'm never going to be able to get treatment. We hear this over and over and over again, and if you look at our report, at more of the findings from our survey, we find that a number of providers just don't have the education that they need, and they aren't going to get it if we continue to make it voluntary.
So we can see we need to reduce experiences of discrimination and stigma in healthcare settings to undo some of those avoidance and delays in cares that are totally logical that LGBTQ people in California are experiencing. The other issues around long wait times, lack of access to affirming providers, is something that we actually also specifically asked about in our community survey. In California, we have timely access to care regulations, which require health insurance providers in the state to have an adequate network so that consumers are not having to wait an exorbitant amount of time in order to get an appointment with a primary care provider, a specialist, and certain other types of providers in the healthcare system. So for primary care providers, the state regulation says there's that people should have to wait a maximum of 10 business days for a non-urgent appointment. For urgent appointments, that's even shorter. 35% of LGBTQ respondents to our community survey waited longer than 10 business days, and 18% waited longer than 15 business days. This is something that has never really been studied before in terms of, you know, what are the disparities in accessing healthcare in a timely manner. And I think it was really, really illuminating to see that our communities are not actually able to see their providers in a timely manner. And this is just for primary care providers. We haven't even gotten to yet, which we will, access to transition-related care or certain types of specialty care where we see even longer delays. And so we know that this is an issue. Primary care is where you go for prevention. It's the first line of defense in making sure that you were leading healthy lives, that were, you know, that conditions aren't escalating. And the fact that it's taking such a long time to see a primary care provider is really concerning. We also see this in timely access to specialists, with 40% waiting longer than the regulated 15 business days for non-urgent appointments. Next slide. We also asked people who had had some type of transition related care in the last year about access to a primary care provider within the distance regulations, which are 15 miles or 30 minutes from where enrollees live or work. 44% said that they traveled longer than 30 minutes just to see a primary care provider. And travel distances ranged from 31 minutes to trips requiring an overnight stay. And this was consistent with what we had heard in our town halls the previous year about people having to travel overnight to see a provider. People from Fresno saying they had to go to LA or San Francisco. People in LA saying there's really only one person in the city, and we know that in LA, 15 miles could be a heck of a lot longer than 30 minutes to get somewhere. So we know this is a huge issue. Next slide. So what can we do about it? We can make sure that we have more LGBTQ affirming providers. We need to increase funding for equity-focused workforce education and training. And we need to increase enforcement of network adequacy regulations. Right now there's a lot of work to be done to make sure that our communities actually have access to affirming providers within their networks and within a reasonable distance to where they live and work. So we definitely have some tools in our toolbox to increase access to affirming providers in California. Next slide.
So 73% of all of our respondents and 84% of our transgender respondents stated that they had wanted mental health services in the past year, which is a far higher percentage than the general public. However, seeking these services doesn't mean that the person is able to access them. The number one mental health service that survey participants wanted but weren't able to access was individual therapy. 95% said they wanted individual therapy in the past year, but almost half of them were not able to receive it. Next slide. We also saw barriers, more barriers to seeking mental health. The top barriers to receiving that mental health services that people needed were, number one, they couldn't afford the services that they wanted or needed, and the wait time for the mental health services they needed was too long. These barriers are coupled with LGBTQ specific barriers, the number one being, I don't know how to find a mental health provider that's LGBTQ competent. Next slide. Part of the problem with not being able to afford services, we think is that almost a third said they weren't sure if their insurance covers mental health services. In California, that is required. So our recommendation is that there needs to be a more transparent way for people to be told what their health insurance covers when it comes to mental health services and how they can get reimbursed if they are seeing a therapist that's out of network. And we need to wrap it up, so I'm going to keep going. Next slide. Isn't that you, Amanda? Oh, all right. So as we saw, timely access, as we saw and we talked about waiting, over half the people that we surveyed said that they had to wait longer than 10 days for a mental health provider. Any of you who know anyone who's ever been in crisis or needed mental health services can certainly testify to the fact that 10 days can be far too long, and more than 10 days can be far too long to have to wait for mental health services. Next slide.
This is me. So one of the big things that I think the survey made clear was that we need to really strengthen mental health parity. The state has taken actions to do that. Just this past year, passing a mental health parity bill, But I think there's still more work to do to clarify the definition of parity so that all Californians have access to mental health care in the same way that they have access to physical health care. Enhancing enforcement of mental health parity requirements. Right now, there's not a lot of teeth to making sure that insurance companies are actually delivering on the promise of mental health parity. And then finally, providing public education for consumers about the fact that these mental health parity policies exist. I think the point that Poshi shared about the fact that such a high number of people said, I don't know if my health insurance covers mental health care is a really important point. By law, all insurance companies are supposed to be covering mental health care. And yet we still have these questions, almost 10 years after the implementation of the Affordable Care Act and parity regulations. So we clearly have a lot of work to do to close that information gap for consumers. Okay. Perfect.
So you might be wondering, why did we do a bisexual needs assessment? So let's go to the next slide. So the first thing that you should know is that there are actually more people who are bisexual than lesbians and gay men combined. And so it's the majority of the LGBTQ population, and it deserves some focus because of that. But even more so because bisexual people have elevated risk of disparities compared to heterosexual and compared to lesbian and gay people. They actually have the greatest disparities based on sexual orientation. So let's go to the next slide. And you can see there some of the physical, psychological, behavioral, and other kinds of experiences where there are disparities. Everything from high blood pressure, arthritis, the number of physical health conditions, mood disorders, anxiety, suicidality. For example, we found in the statewide survey that bisexual people reported the highest rate of suicidal thoughts and intent compared to other sexual orientations. We also know that these disparities are particularly prominent for bisexual people who are also transgender, and transgender people are more likely to be bisexual than cisgender people are, so this is a really important group of people. And in addition to physical and mental health disparities, we also see a higher prevalence of poverty, intimate partner violence, and workplace discrimination for bisexual people. So let's go to the next slide. In the survey, there were over 1,300 people who completed this specific bisexual needs assessment. So there were bisexual people were included in all of the questions, but then people who identified as bisexual or pansexual or otherwise non-monosexual completed some additional questions that we had. So one of the things we found is that most bisexual Californians are experiencing anti-bisexual experiences. And so these are taking place particularly within their families, with their friends, in their school environments, but also in LGBTQ community, which is surprising to some people because they think that would be an accepting community. But bisexual people tend to experience negativity from both heterosexual and from lesbian and gay communities. Fortunately, social support buffered bisexuals from internalizing those negative experiences, and that's something that we found in the survey, so that's something we want to address. Let's go to the next slide, and this just identifies when I say anti-bisexual experiences, what are we talking about? Some of these things reflect common stereotypes or misconceptions that people have about bisexuality. So for example, thinking that it's just a phase, it's not a stable sexual orientation. And these experiences, though, can also be things like people expressing discomfort with bisexual people or alienating bisexual people. So these are some pretty significant numbers in terms of the percentages of bisexual people who are having these experiences. So we want to look at what can we do about that, particularly around things that will buffer bisexual people from internalizing that. And once they internalize it, then that internalized bi negativity can go on to explain some of those health disparities or contribute to those health disparities that we saw. So let's go to the next slide, which is what can we do about this from a policy perspective? So the things we really want to do are to reduce those anti-bisexual experiences, so to make the environment more easier for bisexual people by not having them experience stigma. We also want to increase social support because that can buffer against the stigma. We also want to increase bi-positive experiences. So positive experiences that bisexual people are having, like seeing role models, having visibility, having their bisexuality acknowledged and accepted. So how do we do that from a policy perspective? Well, we want to make sure that there's funding and training for providers, for health and mental health providers, for policymakers, and also for community leaders, in addition to elected officials. We want to make sure that services that are provided are inclusive for bisexual people so that their needs are getting met. But we also probably need some bi-specific services. And one of the things we did as part of the Out for Mental Health project is we helped communities create discussion groups around bisexuality and for bisexual people so that they would be able to have some specific support services. We also need to make sure we're doing outreach to bisexuals, and we need to do this beyond just what we do within the LGBTQ community. So a lot of bisexual people, 84% of people who are bisexual and in a relationship are in a relationship with someone of another gender. So they might not show up on people's radar as being part of the LGBTQ community. We do want to make sure that community is inclusive so that LGBTQ people are being accepting and supportive of and providing social support for bisexual people. And we also want to make sure that bisexual people have some specific community that can help to support them and their needs. Kristina is going to be available during the question and answer period if you have any questions. Thank you so much for being here. We really appreciate your attention.
Hello, everyone. I am Dr. Parra, and I apologize that my video currently is not working, but I hope that you all can hear me. One of my main focuses of understanding and being part of this project is really to understand the diversity of California, in particular the diversity within the LGBT community. We know that there's a lot of diversity within queer and trans people of color, and the experiences that these individuals experience is very unique in terms that they experience racism, heterosexism, and sexism. And all of these things, all these experiences are compounded. For example, queer and trans people of color experience various forms of discrimination within the LGBT communities. What this looks like might be by exclusion and rejection in these spaces of communities that are really vital and important for the well-being of these individuals to healthfully adapt in their society. We also know that queer and trans people of color face a lot of forms of discrimination within their own ethnic, cultural, and racial communities because of their non-heterosexual or non-cisgender status. So compounded, and these experiences may happen concurrently. These are additive and multiplicative, but also very, very complex stressors that that queer and trans people of color experience in the state of California. Can we please, and overall in other states as well. Okay. So one of the things we know about this literature is that queer and trans people of color report high negative health outcomes because of these compounded experiences of heterosexism and racism. And a lot of evidence suggests that there's a lot of elevated levels of depression, anxiety, and suicidal ideation among these groups of individuals that range across the lifespan. But one of the limits of the science so far is that we really don't understand how all these experiences of oppression happen concurrently, whether they're happening within their home environments, their school environments, social, and in society as a whole. So one of the things we really wanted to understand with the community survey was to understand what's the state of these experiences in describing oppression from racism and heterosexism within the LGBT community in California. Next slide, please. So one of our assessments and questionnaires we asked of all the queer and trans people of color in our survey is how have they experienced discrimination, racism within the LGBT communities? And some of these example items ask people whether they felt included in the LGBT community because, or they felt rejected or not desired based on their racial characteristics, even though they are part of the LGBT community. And what we find here are these averages where Middle Eastern and North African, as well as Black African and African American participants reporting the highest level of discrimination, of experiences of discrimination within the LGBT community. Next slide as well, please. And we also find that the Middle Eastern and North African and Black African and African American participants also reported the most heterosexism within their ethnic communities. This is just to highlight how it's important for us to consider the multiple forms of oppression that LGBTQ people of color experience, and how targeted efforts are really necessary to understand the different compositions and different groups and how they experience discrimination based on their social location, that is, being a queer person or trans person of color. Next slide, please. Now, in part of the assessment, community assessment, we really looked at some suicidal ideation, and here it really is just a snapshot, trying to understand how these experiences and how queer and trans people of color may be impacted disproportionately because of the multiple forms of oppression that they experience. In the graph here, you'll see that monoethnic people of color and multiracial people of color both reported the highest frequencies of suicidal ideation in the past year. Now, this really highlights the importance of really trying to understand and comprehend how social inequities, such as discrimination because of one's sexual orientation or ethnic or racial background, really creates these internalized social stressors that manifest themselves with higher risk for suicidal ideation and other poor health outcomes in these marginalized groups of people. Can we please have the next slide? So there's some, so here's some recommendations by which policy can really help us fund programs that can hire, train, and provide community providers, and mainly focus on hiring people who belong to those marginalized communities so that they can bring this perspective from the community that they're a part of and really inform community providers and other researchers and allies in terms of making sure that we're creating more competent and culturally competent advocacy to be able to address these issues. Again, we really need to emphasize a lot on providing continuing education and cultural humility to really, again, understand certain political or religious or ideologies that might be inherent in some of these groups, to be able to understand and dismantle a lot of these oppressive perceptions to help these individuals thrive in their communities. And we also need to adopt culturally relevant innovations in terms of where we apply, when we work with interventions and working with clients who have multiple oppressed, marginalized identities. And for this reason, I think it's important to allocate more funding to be able to invest in these tasks, to be able to really fulfill the needs of LGBTQ, trans and queer people of color in the state of California.
Hello. In 2019, Out for Mental Health held a virtual town hall to learn about the needs of LGBTQ sex workers in California. Today, I'm going to focus on their statements, and I strongly encourage you to read the entire section regarding LGBTQ sex workers in our new report, Surveying the Road to Equity. So the sex workers we spoke with emphasized that consensual sex work is a legitimate choice. Most importantly, they said, if the greater community could understand that consensual sex work is not human trafficking. Also, it's a job choice like any other choice. For example, you either get into your job because you chose it, or like most people in every kind of job, which is that you get into this work by circumstance and that it was the best opportunity you had in the moment. And as many of them also explained to us, Sometimes it was the best way to pay the bills. As one participant said, I was 25 and working multiple minimum wage jobs and just struggling to pay the rent. And in that case, she chose to do sex work. Next slide. There is an equity in how we as a society and as the state of California treat sex work. For example, stripping and adult films are legal, but those avenues aren't open to everyone. What our participants told us is there's something called the hierarchy, which is multi-layered, and where there are more privileged sex workers who don't have to stress about their daily survival, but that this is at the expense of other workers locked out of those echelons of the trade. As even Luis was just telling us, there's discrimination based on race. There's also discrimination based on body type and gender identity. As one person told us, I know sex workers who worked themselves through school. I know someone who paid their way through college and became a CPA through stripping, but that wasn't an option for me. As a trans person, my body had a limited marketability. So those who can't access the upper echelons of sex work are subject to higher risk for violence and encounters with law enforcement. Next slide. What we heard over and over and over, more than any other institution, law enforcement is the problem. And we've all experienced what's happened recently with the murders of George Floyd and others and the Black Lives Matter movement. But prior to that, we also heard from our sex worker town hall participants about the issues and problems that they've had with law enforcement. As one person stated, I've heard multiple stories of sex workers being re-victimized by the cops, and that you can't go to law enforcement when something bad happens. We had one person talk about the time that when they went to law enforcement after being victimized, that the police officers that interviewed her went ahead and re-victimized her again. Next slide. As in our first report, Mapping the Road to Equity, we recommend, Out for Mental Health recommends full decriminalization of all consensual sex work. We're not talking about legalization, we're just talking about decriminalizing. And when we say full decriminalization, we mean for both the sex workers and their clients. Only decriminalizing it for sex workers still leaves that impression that there is something criminal and stigmatizing about this work. There's many benefits for full decriminalization, including providing increased agency for sex workers, allowing sex work to be considered under traditional employment law. It will also help to reduce the incidence of HIV and other sexually transmitted diseases. Next slide. It will absolutely reduce the incidence of violence and exploitation of sex workers, especially because of the criminalization right now. Sex workers are not able to communicate with each other and fully be able to gather the information they need to talk about people that need to be avoided. It will also increase positive health outcomes for sex workers and increase the likelihood that sex workers will seek protection from law enforcement when victimized. And as we've already said, if it's decriminalized, there's no reason for law enforcement to step in and negatively impact the lives of sex workers. Thank you very much.
Hi, everyone. My name is Nicole Scanlan. I just am going to present some information we found at our 2018 Out for Mental Health Key Informant interviews with experts working with LGBTQ refugees and asylum seekers. LGBTQ asylum seekers and refugees migrate to the United States to escape persecution, violence, and harassment in their own home countries because of their sexual orientation. They often feel like coming to the United States will be a welcoming place for them and that there are benefits settling here. However, from our town hall interview, we found that that's not been the case for those who've been housed in California detention centers. In fact, our experts told us that detention in and of itself is creating and exacerbating mental illness for detainees. As one person stated, a lot of detainees were suffering from PTSD before detention, and detention made it worse. Our experts spoke of unsafe and unsanitary conditions in detention centers, including a lack of healthy food, food safety issues, and inadequate mental and physical health care. Next slide. Our experts also greatly expressed concern about misdiagnosis and heavy medication in detention centers. And we were told that those who were given medication were not given the support of medical treatment plans after their release. This means that they're being released without medication and are at risk for severe withdrawal. And with some psychotropic medications, this can lead to death. Next slide, please. Our experts also spoke about the harsh and inequitable treatment of LGBTQ detainees by California law enforcement running the detention centers. For example, LGBTQ detainees were left in their cells for 22 hours a day, while non-LGBTQ detainees had plenty of time outside. We also heard stories of officer retaliation, including solitary confinement towards LGBTQ people on the pretense that they were organizing. Another thing is that LGBTQ detainees are also prohibited from hugging or giving comfort to one another, even though this is allowed for non-LGBTQ detainees. Next slide, please. In detention, our experts told us that there are multiple barriers for detainees to access adequate care, but more than anything, being inside the detention center is a barrier. Our experts specifically noted that detention centers lack privacy, which can create unsafe conditions for LGBTQ detainees. They also noted that many detention centers have convoluted protocols in place that make contacting detainees and providing services extremely difficult. Our experts also expressed frustration with trying to help refugees and asylum seekers once they've been released from detention. As one expert stated, "I wish I was prepared to care about this population." Released asylum seekers and refugees need much more than legal services. They need language services, access to basic needs, mental and physical health support, and someone to help them navigate the complicated systems we have in place. Next slide. As we begin to discuss recommendations for California legislators and policymakers, we'd like you to keep in mind that our experts told us that providing support to one asylum seeker takes a village. For a group of asylum seekers, it takes a city. Next slide. Out for Mental Health recommends that the state expand Medi-Cal to all undocumented people, including individuals over the age of 25. This would provide undocumented immigrants, refugees, and asylum seekers with the necessary health insurance needed to access mental and physical health care. We also recommend that California legislators and policymakers do what they can to remove barriers to accessing services for undocumented immigrants, including fear of detention or deportation. Next slide. And for LGBTQ asylum seekers, we recommend the elimination of detention because LGBTQ asylum seekers are more at risk for severe negative outcomes than non-LGBT asylum seekers. Although we do recognize that eliminating detention would also be beneficial for all asylum seekers as they go through the asylum seeking process. One way to get LGBTQ and other asylum seekers released from detention is to have sponsors in the community who can provide a safer environment and greater access to services and support. And we need to build a network of support to support these sponsors in their work. I really appreciate you giving me time to give this speech to you today. Thank you, and now I'll turn it back over to Amanda and Poshi for the Q&A portion.
Awesome, great. Thank you so much, Nicole, and thank you to all of our presenters. I wanted to share, I know Mandy put in the chat box, if you have any questions, please type them into the Q&A box. You can also raise your hand and we would be able to unmute you. Although the typing it into the box is probably the easiest and will take the least amount of time. The other thing that I just wanted to share is we will be making the recording of this presentation slides and slides available on our website, and our full 2019 State of the Community report is now available on our website. So you can find a full write-up of the findings from our community survey and the bisexual needs assessment, as well as our policy recommendations and the sections on LGBTQ people engaging in sex work, and LGBTQ refugees and asylum seekers in that report as well. So there will be much more detail there. But since we do have a little bit of time, would love to answer any questions that folks have. Okay, I see a question from Paulina Angel. What can we do in regards to working with and educating law enforcement in our areas on the mental health of our community? So I think, you know, we've worked with a lot of partners throughout the state on these issues, on, you know, either working with law enforcement or providing alternatives to criminalization, alternatives to jail and enforcement. A lot of it, you know, a lot of the things that you know, we talk about is investing in mental health prevention services. Prop 63, the Mental Health Services Act, does provide funding to all counties throughout the state to provide prevention and early intervention services. And that's a great way to really address mental health issues in a healthier and more productive way than shifting them to law enforcement. And Poshi or any of the other presenters, I'm not sure if you wanted to add anything to that as well.
I think I just want to add that there are many things that law enforcement is called upon to do that really shouldn't be and wasn't meant to be part of their jobs initially. And so, especially when working with mental health consumers and other people in need, it would be better if we had social services and people who are trained to work with them, and that law enforcement be reserved for people who are breaking the law and doing so not because they're in the middle of a mental health crisis.
Absolutely. We also did provide comments on the Mental Health Services Oversight and Accountability Commission did a report on criminal justice and mental health. And we did provide some comments on, you know, what that means for LGBTQ communities and really the importance of diversion and appropriate services. I see a question from Matthew, and I actually feel like this might be a good question for Seve. If you want to take it, do you expect to see some bills introduced in the next year or so to address any of these issues? I'm not sure if you have any inside information on what the caucus's legislative package will look like yet, or if that's still kind of in the works.
Good question. I think that I mean, short answer is yes, still very much in the works. I think that without giving too much away, some of the things that were talked about in today's presentation, I think there are conversations about tackling. Obviously, there are some really big pieces that we need to pick up in order to actually advocate for the ultimate goals that we've talked about. But with that said, I know that if there are specific things that folks want to talk about, of course, feel free to reach out to your state representatives, but also for those people that are involved in more policy-centric communities or circles, I should say, professionally, please feel free to reach out to myself. I'm more than happy to share my contact information. And I know anybody in the caucus would be happy to hear you out.
Awesome. Thanks, Seve. I see a question also about the survey, the State of the Community survey, and how diverse the group was. And I just posted a link in the chat to the full State of the Communities report, which includes our methodology and information about the samples, the sample size and breakdown of the sample. It was an online survey, so it was conducted online, and we did outreach through social media, through Grindr, through community partners, And we also partnered specifically with Trans Latina Coalition and Gender Justice LA with some funding from CalMesa to specifically reach out to trans people of color in LA County to get some additional do some additional outreach there. Poshi, I don't know if you want to talk more specifically, if you know those numbers off the top of your head.
I kind of do know a couple of numbers, and it depends what you mean by diversity, because that could mean all kinds of things. But in terms of race and ethnicity, half of our respondents were people of color, whether they were monoracial people of color or multiracial people of color. We also had half of our sample were ages 25 and younger, so we had quite a representation for our youth. We also had an overrepresentation from people living in rural areas to make sure the numbers would be strong enough to report on them. And I think the other number I come up with is a little over a third of our respondents, their gender identity did not match their sex assigned at birth, putting them in what we call the trans spectrum. If there's something else specific you want to know, please make sure you put it in the question part, or just look at our report.
Awesome, thank you. I'm glad you know those numbers off the top of your head. We also have a question here from Arden. Did you hear any feedback from respondents regarding resources for suicide attempt survivors? It says, and that the only known resources in California are in LA County. I will say our survey didn't really have a lot of fill-in boxes, so it wasn't really possible to get feedback in that way. But I don't know, Poshi, if when you or Luis or anyone, when you were looking at that data, writing up some of those sections, if you have information about what resources may be available.
So one of the
I'm just going to give.
Oh, go first, Poshi.
No.
So one of the things, we didn't have any qualitative data within the assessments of the suicide questions that we asked, but there are some resources, and primarily one of the largest ones that I know of here in the state of California has been the Trevor Project, which has hotlines. But I do think that more advocacy has to be placed in having more of these centers available throughout the state to be able to address the disparities in suicidal ideation and attempts. And yeah, but I think this is kind of what the report will be highlighting, those disparities and more funding needed for those services.
And all I will add is that this is a need among all people who have how did Arden word it? Relatives or people who have with people who they've loved who've had suicide attempts. There's just not a lot of resources for survivors of suicide attempt and their family. So this is needed across the board, and I can just tell you from experience that therefore, if it's not there for the straight and cis people, it's not there for the LGBTQ people either.
Also, one thing just to highlight is that California did recently establish an Office of Suicide Prevention. So they will be looking at additional ways to, additional policies and resources that the state can implement to prevent suicide. And LGBTQ communities are specifically highlighted in a number of places around the importance of addressing our communities in suicide prevention work. And I would say working with survivors is an important part of our prevention strategies as well. Let's see, I think I see one more question. And thank you, Ambrose shared that there is an agency in San Diego that works specifically with survivors of suicide at the NAMI San Diego website. And Linnea, I'm going to go ahead and unmute you because I see you have your hand up. Let me see. Oh. I lost you. There we go. Did you have another question, or was it the question that we did talk about?
It was a question that we talked about. Thank you.
Oh, okay.
Yeah, I was just curious to know how that how the data was collected and how diverse the group was. So thank you for sharing that link too.
Yeah, absolutely. You're welcome. Perfect. So I think, Mandy, are there any other questions that we've missed?
Nope, that is all of them. I will say somebody did have a question regarding sex work, and I'd like to read the question, which is, won't using the term full decriminalization conflict what is being advocated for and worked on nationally with partial decriminalization, holding traffickers, pimps, and purchasers accountable? And I just want to address that Out for Mental Health supports decriminalization of consensual sex work, and that human trafficking by its very definition is not consensual. If a minor is under the age of 18, they legally cannot consent to sex. So anybody under the age of 18 engaging in sex work is by definition not engaging in consensual sex. And we certainly would not ever advocate to decriminalize the sexual assault of children, or those who would sell them or purchase sex from them. So I just wanted to clarify that. Those of us that worked on this section of the report come from a background of working with trafficking survivors, and actually really strongly believe that decriminalizing consensual sex is one of the best ways to protect sex trafficking survivors, because that's how we can make sure that they feel safe getting help and they're not going to be criminalized. Many young survivors are incarcerated and put in institutions for their own sexual assaults. So it's why we so strongly believe in decriminalization. It protects survivors.
Yep.
Thank you, Andy. Great. Well, thank you, everyone, so much for being on, for being so interested in learning more about the findings from our survey and on working on policies to improve the health and well-being of LGBTQ Californians. We really appreciate also the partnership of our friends at UCSB and USC. I think Tania's gone, but thank you so much to Kristina and Luis for your work on the survey and the report and the briefing today. Thank you so much to Seve and Alina and the Legislative LGBTQ Caucus. And we really, and thank you to all of you who joined us today.
Thank you.
Thank you.
Thank you so much. Have a good weekend.
Thank you. Yeah, everyone have a great weekend.